All right, Doc, let's get to our viewer question. I don't know if they have anything to do with the quarantine 15. Let's start with hair loss, though. Question 1 from a viewer. Has there been any documentation of hair loss as a side effect of COVID-19 infection?
A lot, you guys, and I'm hearing more and more about this every single day from viewers, from my patients. This is the typical time period we would expect to see kind of a shock alopecia or hair loss, which we can see after a stressful physical or in some cases emotional trauma acutely. Happens 3 to 5 months later. The good news is most of the time that hair growth will restore itself, but it can take months for that to happen because such is the life cycle of a hair follicle. A lot of people noticing this.
All right, well, earlier we were talking about pediatrics and COVID-19. This is a very specific question. Have we seen any adverse COVID-19 related effects on newborns?
So neonates you're talking about right after delivery, you know, in the first couple of weeks after birth, very, very limited data. What is available right now suggests luckily, there have been no major case reports of acutely ill neonates, even those who have moms who were COVID positive in the delivery room. So again, we know that newborns are very vulnerable to all types of infections. So medically, socially, everyone erring on the side of caution when there's a COVID positive mom, taking all the precautions, masks, gowns, gloves, hand washing, but trying to keep that mom and newborn with their baby as much as possible. Very tough situation.
All right, next up here, does the sun have any effects on COVID-19?
All right, TJ, now follow me on this one.
All right.
Any virus, and in fact, most pathogens can be deactivated. They can be desiccated when exposed to sunlight. The question is how much sunlight for how long a period of time. And we also have to say, unfortunately, we do have to make this crystal clear, not once COVID is in the body. You can go out and get all the sunlight you want, and it's not going to do anything to SARS-CoV-2 once it's in your body and causing an infection. So you have to balance that. Get some sunlight, get some vitamin D, but not because you think there's going to be an instantaneous demolition of the SARS-CoV-2 virus.
Oh, that
There you
doctor
go.
speak. Instantaneous demolition of the virus.
Right.
You can submit your questions to Dr. Jen on our Instagram at Dr. J. Ashton. Thanks as always.
You bet.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.